Dr. J, you could use the left and right, buttons on the keyboard to scroll the slides when you are in the present mode.
Okay.
Yeah, and you please keep on the present mode for now so that the slides are on the full screen.
Oh, did I get out of that now?
Yeah, you did.
I think I messed up. Okay.
Looks perfect now. Looks perfect now. Yeah. Thank you.
I'm no techie on this one, Manoj. Apologies for that.
That's perfect, sir.
I use the Mac.
Yeah.
Is there a good a system to use, Mac or the Windows?
Yeah, depends on the choice and depends on the comfort. I use right now I'm using Windows and it looks fine.
Okay.
Yeah.
Okay. And also I use the Google Slides to prepare my slides as opposed to the PowerPoint.
Yeah. So Google Slides are great.
Yeah, it kind of a little easy for me.
Yeah,
definitely.
That's right.
Yeah.
So we'll begin in a moment or so, maybe another 1.5 minutes from now.
Yeah.
Good evening, everyone. We'll begin in a moment or so. If you have to invite somebody in this for this session, please do send the link to them. And I'll be sharing the link in the chat box for your convenience. We are also going live on YouTube. So if you want to watch us there, you can watch there as well. But I suggest you be on Zoom because Zoom offers more of interaction options for us. And try to be more interactive during the Q&A session specifically. If you have any questions, you can put in the chat box and we'll take during the Q&A session. So Dr. J, it's 7. Shall we begin?
Yeah, sure. Absolutely.
Perfect. Thank you so much, Dr. J, for consenting to be a speaker for us and helping us understand the various career opportunities in the US. And I would like to thank everyone who has joined us for the session today. And thank you so much for being part of this wonderful, Zoom session where we'd like to explore various opportunities in the US. So before we begin, I'd like to introduce Dr. J. Dr. J he has done his Pharm D, MS, and he is a board certified clinical pharmacist at St. Rose Hospital, Las Vegas. He comes with more than 25 years of clinical pharmacy practice in a hospital setting in the US and 7 years of academic and community practice in the international settings. He is a global pharmacy practice advocate. He is a passionate pharmacy professional who works towards achieving healthcare equity and expanding access for all. He loves teaching evolving clinical pharmacy concepts, and that's how he is here with us to help us understand how clinical pharmacy works in the US and what are the various career opportunities for higher education and also for higher education and also for various job opportunities in the US. So let's explore with Dr. J. Dr. J, the stage is all yours. You're most welcome for this session, and you can start now.
Thank you, Manoj. I appreciate your introduction. That has been very generous. Appreciate it. And also, I thank the participants on a Saturday evening. Instead of going out, having a few drinks, enjoy your weekend, you have some time to spend on this webinar. I think it might be definitely useful. The topic that we are going to be discussing is the exploring educational and career opportunities in the US.
Yeah.
When this topic was suggested by Manoj, I was a little bit reluctant for the reason that it is not a clinical pharmacy practice topic, but it is a topic that would be of a lot of interest in India for the reason that most people would like to come to the US.
Yeah.
I'm going to be honest with you guys. I will be presenting factual information. And I have been contacting some of the agencies like ACCP and ASHP and NAPLEX Examination Center and NABP. We will go through these acronyms when we go into the slides. I was trying to get correct information so that what I relay is going to be dependable.
Yeah.
And of course, if I miss something, if I misspeak some of the facts, please point that out. I will certainly research and clarify those questions for you. Just to give you a little background of how I got here from a small village in Tamil Nadu. I grew up in a small village near Madurai called Andipati. That's where I did my schooling. And my B Pharm is from Madurai Medical College. When I finished my B Pharm, there was no job opportunities, so pretty much nothing. I tried to get some job in North India. I tried to get some job in Tamil Nadu, in any place in India, and it was very scarce. The first opportunity that came along in a small hospital that was beginning to open in Coimbatore, where I took the job. It was actually a job meant for D Pharm candidates, but I need a job. So I told them I would like to work as a pharmacist. And if you would give it to me, I appreciate it. And the management gave me the offer and made me a chief pharmacist. That's where I began. And after probably a year, I went to Manipal to work as a lecturer at the Kasturba Medical College School of Pharmacy, where I stayed for about, I believe, 4 years. 4 years, yeah. That was my best time in my career life that I enjoyed the most, better than being here in the US, to be honest with you. And I had to leave Manipal because of the family commitments. I needed money. So I went to Abu Dhabi, where I had an opportunity to work with a hospital that gave me a good money. I took care of my commitments. Then I thought it is time to move on. My roommate in Abu Dhabi, a gentleman from Pakistan, he was appearing all kinds of examinations, the TOEFL and everything else. I asked him, hey, what is TOEFL? And he explained to me it is the test of English as a foreign language. That's what I'm taking. I asked him, why do you take it? He said, I'm going to go to the US. And I asked him, can I also do the same thing? And he told me, yes, of course. When I can do it, why you cannot? So that night I was thinking about it. Then I started working on the examination processes, went to Dubai and took the TOEFL exam. At the same time, I was applying for my master's degree, every place in the States, 30, 40 colleges. And I got only one offer from New York City, from Brooklyn College of Pharmacy, to pursue master's in industrial pharmacy. So I went to the US Embassy, got the visa, and came to New York City, where I finished my master's degree. While I was doing my master's degree, I was able to apply for the licensing exam. Those days, there was a lot of needs for pharmacists in 1980s. So the pharmacy board was very lenient in approving foreign graduates to take the exam. I took it, then I passed the first qualifying exam. Actually, I took the New York State Board exam directly, and I got the license. Then afterwards, I wanted to move around the states, for which I had to pass the foreign pharmacy graduate equivalency exam. Then only I'll be able to get the reciprocity. So I did that. Then I moved to Maryland. I came over to Florida. Now I'm settled down in Las Vegas, the gambling city. And this story of me coming here is not in my story. But I'm here. It might be because of accident, I should say. This is the city where I live in. Someone told me, right, if you just show a picture of where you live and where you work, that'll be great. It'll start the session, a little bit nicer. People would like to know that. So I thought, okay, I will put a snap of the Las Vegas city. I don't go to the strip very often. Someone comes from India or someplace, I take them over there, do a little bit of gambling, lose money, and then come back. And so the life is a gamble, and that's why I believe I ended up here in Las Vegas. And this is the place I work, St. Rose Hospital, Siena campus of Dignity Health. This is a 400-bed hospital. I have been here for about 16 years. As of this year, I reduced my full-time job into a per diem job, meaning that I might work, one day a week, maybe a couple of days a month at my discretion because I'm getting old. I got the COVID, so I cut it down. I thought it'll be time to retire and probably spend some time with particularly, pharmacy professionals in India. So that's the place of my working. Am I clear, Manoj? Is everyone is able to follow me clearly? Do I have to slow down a little bit?
Absolutely, sir. Looks like most of us want to go to Las Vegas.
Yeah, please come on in. I'll be your, guest or host, whatever. I will take care of you. You can come and stay in my home if you can get here. It's not impossible. It's definitely possible. So let's not rule that out.
Absolutely, sir. Absolutely.
Yeah, that'll be great. Let's see. This is the objectives of the webinar today. I had to gather information. When Manoj asked me first, I told him I need a couple of weeks to gather, dependable, evidence-based information. That's what we look for as a clinical pharmacist, evidence-based medicine. Everything is evidence-based. That's what I like to indulge in. I will discuss briefly on the higher studies for pharmacy graduates from India in particular. And also I will go through some of the prerequisite exams and various areas of specialty, meaning you've got all kinds of branches, specialty subjects, which I'll go through. And then we will jump into the licensing process in the US for foreign graduates. Not only India, it could apply for anyone else, Pakistan, Middle East, etc. Thereby, we will get into the next final step is the pathway to become a pharmacist. There are a lot of jobs available. It could be drugstores, hospitals, academics, administration, or pharmaceutical industry. But the competition is becoming increasing lately because there are too many schools of pharmacists popping up in the US like mushroom. Because they know there are jobs available, and some of the universities want to get into the arena and offer courses, and putting out pharmacists. And then we will finally, the most important point is to discuss the challenges in terms of immigration and financials. And finally, we will do some questions and answers. Any questions so far, if you would like to throw that in before I proceed?
Nothing as of now, sir. I shall be taking all the questions, and then we'll discuss during the Q&A.
Beautiful.
That will
you
help us to
will
go with the
streamline all the questions, and
yeah, I'll take care of that.
That'll be a wonderful procedure. First of all, let's go into the postgraduate studies and the qualifying exam. Number one, if you want to do a master's program, even PhD for that matter, this applies to not only Pharm Ds, it applies to B Pharms, M Pharms, and every pharmacy professional because we are one family, right? If you want to do a master's program to begin with, of course, you know these tests already, most of you would know. The TOEFL is the first one you must take it, which is the test of English as a foreign language. I would suggest that all of you take it, regardless whether you want to come over here or not. That'll be a wonderful experience. And the GRE, the Graduate Record Examination, is required mostly for master's programs such as MBA, Masters in Business Administration, Masters in Data Science, other fields. They would require the GRE, but definitely the TOEFL is vital. That's the number one exam because they want to say that we are proficient in the language. Of course we are. It's not a very tough exam that I took 35 years ago, I believe. So these are the two exams that you might want to concentrate to begin with. And to do these two exams, you have to go to the website. If you want to make a note of that, it's the ets.org, Educational Testing Services. That'll give you information as to how to apply, what's the fee, and where are the locations. They are available, I believe, all over India. And you might want to go through the information if you're interested. And especially for Pharm D board certifications. In fact, I called the Board of Pharmacy Specialties, the BPS.org, yesterday and called them up. And I came to know that these Pharm D board certifications is not only available for Pharm D, even for B Pharm and N Pharm graduates, as long as they meet the criteria. I believe they have to have 3 years of clinical pharmacy practice. If you have that, then they do allow that. And I have the website there for you, which is the BPS, Board of Pharmacy Specialties. Just make a note of this. These are the first steps one should be taking before planning to move over to the US. And the next slide is this slide oh my God, I went back to the other one. How do I go back to the next one?
Sir, right click, sir. Right arrow, right and left arrow.
Right arrow, okay. Oh, that's beautiful. See, I told you I'm not a techie on this one.
I'm here, so don't worry.
Okay, good. Oh, it's keep going back here. I have to be careful. My laptop is very sensitive. Are you able to see the slide
Yes,
fully,
sir.
completely?
Yeah.
Okay, because this slide looks too busy. We will spend some time on this.
Yeah.
Apologize for that, because I wanted to condense it as best as I can. That's why it looks kind of crowded. First, let's concentrate on the right side box. These are the master's program available for B Pharm, M Pharm, and Pharm Ds. And if you go through the master's program, see, these are also about dozen programs that I thought, one might be interested. There are much more programs as well. Clinical pharmacy, advanced pharmacotherapy, industrial pharmacy. That's my specialty in my master's degree. I've got a master's degree when I came to Brooklyn, New York, where I pursued the MS in industrial pharmacy, which is not of great use right now because I'm a clinical pharmacist, came over to the hospital side. In fact, when I came to the New York, when I went to the school, my admission was for the clinical pharmacy. Even 35 years ago, I wanted to do clinical pharmacy. At that time, clinical pharmacy was in its just beginning stage in the US as well, 1980s. When I came here, I talked to a couple of Indian friends in the same school. They were all doing industrial pharmacy. And they told me, hey, Jay, if you do clinical pharmacy, and if you go back to India, there is no clinical pharmacy in India. What are you going to do? So I started thinking, then I might have to have an option. If I go back to India, I may not be able to find a job for that because my intention is to go back to Middle East and be in India. So to be on the safe side, I took the industrial pharmacy. I spoke to my professor. He agreed to switch me over. That's not a problem. So that's what my specialty pharmacy is. And also there's a MS in cosmetic sciences, cosmetology. If you want to make manufacture cosmetics, they have the specialty clinical toxicology and MS in pharmacology, toxicology. I believe Manoj is good at pharmacology. He has specialized in that, I believe. Correct me if I'm wrong, Manoj.
Sir, I did MPharm in pharmacognosy.
Pharmacognosy. Oh, I see.
Pharmacognosy, yeah.
Okay,
But
I
then
kind of misread the term.
yeah, I did.
That's the roots and barks and
Yeah, right.
extractions, concoctions and all that. Okay, yeah. There is no pharmacognosy in this country.
So
that I
I
know
did
of.
in pharmacognosy, but I spent the whole life in medical communications and medical writing.
Excellent, excellent. I can see that. Yeah. You are a jack of all trade, I believe, huh? And I'm masters in nothing. Yeah, in any case, yeah, you can do all these different, specialty, pharmacy administration, clinical research, patient safety. I believe you guys celebrated patient safety yesterday, September 17th or so. And you got, other degrees, biomedical sciences, pharmaceutics, engineering, human genetics, genomics. Genomics is a big topic now. If I were you, probably I would concentrate on the genomics because a lot of drugs, they affect our genes and how the ADME, the absorption, metabolism, excretion, a lot of them are depending upon gene therapy. So if someone has the gene, overactivated or underactivated, there will be a difference in the response of the medication we take. So it's an upcoming field, and I'm just learning it for my own interest. So that would be a great topic of interest. And of course, the pharmacogenomics is the specialty available for that. If you want to get these postgraduates, you have got to have the TOEFL, the minimum, the test of English as a foreign language. And for the Pharm D graduates, these are the board certifications. When you have a degree Pharm D, if you have a board certification, I think, in my experience, this is as good as having a master's degree if you want to get a job. Nowadays, in this country, the hospitals are looking for Pharm Ds. If they have the board certification and residency, they would get priority, although you have a master's degree and PhDs, because this one is focused on clinical pharmacy practice. So Pharm D graduates, if I were you, I would probably concentrate on this, how to get this done, which we will discuss in the future slides. Even B Pharm will be able to take it. M Pharm will be able to take it, as long as they meet the requirements of having some clinical pharmacy experiences in your career. These are the different, specialty offered by the ACCP, which is the American Clinical Pharmacy. And you can find information, if you look at the bottom of the slide, in the little turquoise color, you will see the bpsweb.org at the bottom of the slide. If you go in there, you will be able to see a complete information. And also it gives you what are the requirements that you should be concentrating, paying attention to, particularly for foreign pharmacy graduates. The first one is ambulatory care pharmacy. Ambulatory care pharmacy is clinical pharmacy practice designed for outpatient clinics, medical clinics, same-day surgery centers, dialysis centers. Because in these places, when patients go, they do get prescribed medications, right? At that point, a board-certified pharmacist in ambulatory care will be able to screen for any drug therapy issue and fix it right there before it's being prescribed to the patient. It's a topic by itself. We can probably discuss it at a different webinar. Cardiology, if you want to work with a cardiologist, this should be your specialty. You will be focused mostly on cardiology, like the cardiologist. And there's a new division, compounded sterile preparation pharmacy. This one was introduced last year because of the reason that hospitals were running out of certain critical drugs. For example, epinephrine, phenylephrine. These were not available from the manufacturer for some reason. Some of the reasons I thought are that it's sad to say the pharmaceutical companies sometimes, they don't make those infusions, injectables, critical drugs, if they're not very profitable. Sometimes they stop manufacturing. It may be one of the reasons. Sometimes the active ingredient and the component and the chemical may not be available. So for those reasons, the hospitals will be running short on those critical drugs. In those cases, the pharmacy department within the hospital has a clean room where they'll be able to prepare it because they are for immediate use. That's one of them that was introduced last year. And the next one is the critical care. If you want to work in intensive care units, critical care units, that'll be the concentration that you might want to look at. Geriatric pharmacy, that's the elderly people, 60 and above like me. Once you reach 60 and above, your body system, particularly kidney function, decreases by a little more than 50%. So you got to identify those drugs that are cleared by the kidney and adjust it accordingly. Most of the time, it'll be lower dose, not the dose you would prescribe for young adults. Nuclear pharmacy, that is, focusing mostly on nuclear materials. Most of us may not be interested. Infectious disease pharmacy to concentrate on antibiotics. A nutritional support pharmacy, TPN. TPN is the total parenteral nutrition. For those patients in the hospital, those who are not able to eat orally, or those patients who have surgery in the GI tract, they may not be able to eat it. So this parenteral form would give you all the proteins, lipids, and the carbohydrates that the patient needs on a daily basis, which is a good topic, in my opinion. Oncology, of course, chemotherapy, pediatrics, focused on, little kids. Pharmacotherapy. Pharmacotherapy is kind of a little bit of all of this. That's where I got the specialty certification because I kind of like it. It's better to know all of them individually than focusing on a particular topic. That was my preference. It's kind of an internal medicine doctor, right? So I would be a general internal clinical pharmacist, psychiatric pharmacy, and lastly, the solid organ transplantation pharmacy. So these are all various options available, board certifications, and these are the master's program that you might want to look at as a possible option. Any questions so far? If not, I will proceed, and then Manoj would condense all the questions together.
I'm compiling the questions, sir. I'll take up during the Q&A session. I'm just compiling all the questions.
Excellent. Thank you, Manoj.
My pleasure, sir.
And here is your first step. This is where you want to spend most of your time researching if you want to be serious in getting to the US, the land of opportunity, so to speak. First, any foreign pharmacy graduate has to go through this exam, no exception. There are some confusion I learned in the last couple of weeks contacting some of those organizations responsible for accreditation. It was a revelation to me. They told me, I have an email. I can send it to Manoj if you want to verify that. Every foreign graduate, doesn't matter. You're a Pharm D graduate with 5 years, or B Pharm graduates with 5 years, or M Pharm, PhDs, they have to take this exam, Foreign Pharmacy Graduate Equivalency Exam. And this information is available at the website on the very top, nabp.pharmacy, National Association of Boards of Pharmacy. This National Boards of Pharmacy actually takes care of all 50 states, and they kind of organize and mediate the exams before the foreign graduates, not only foreign graduates, even the local US graduates become certified as a licensing pharmacist, nabp.pharmacy. If you go in there, on the first screen, there is an option in the drop-down menu as a foreign pharmacy. That's where I clicked on. I just took a screenshot of that and put it as a slide so that you will be familiar when we go in there. The exam you will be taking is FPGEE, Foreign Pharmacy Education Equivalency Exam. Actually, it's the most recent information for 2021 for pharmacists educated outside the United States. No matter who that is, they got to take this exam if you come from a foreign country. And this exam is overseen by a committee, and they will go through your credentials, your degrees, your transcripts, your experience, and they will approve you before you will be able to take the exam. And there are some practice tests. If you look on the right-hand side, there are some model exam, practice exams they allow you to take. So this is where you want to begin as a foreign pharmacy graduate, to take this exam first. What is the process to take this exam? Number one, like I told you, you have to take TOEFL first. Go ahead and take it. It's an experience. Even if your intention is to come here, for some reason, if you're unable to, it's a very great experience, TOEFL exam. It's available in India. I'm not sure of the fee for that, and I believe it's worth taking it. Then, once you pass that exam, register at NABP, the National Association of Boards of Pharmacy. You got to go and register. That would be your second step. When you go in there into the NABP website, it'll ask you to create an e-profile, electronic profile of yourself. And if you happen to notice in my previous slide, you probably see my name on the right-hand corner. See that, Manoj? On the middle, the National Association of Boards of Pharmacy, between the two lines on the extreme right.
Yeah.
Did you see that? Okay.
Yeah.
So I got a number there, e-profile number. So when you register that, you will also have name and your number right there. And then after you create the e-profile, you will send in the credentials, meaning your transcripts, your experience, and the application fee. I believe the application fee is something like $200 to $300. Those informations are available in the website. You can make sure that by going into there. So they will go through all your credentials, and then if everything is satisfactory, they will send an authorization to test, ATT, an authorization to test. And that ATT will directly go to the test center, the center that administer the FPGEZ exam, which is the Pearson VUE Test Center. So you will get an email from that administration center. Hey, you got an admission here. You've been approved to take the foreign pharmacy graduate exam. And when you get it, then you might want to proceed and schedule the exam date and take the FPGEE test. And I was researching on it. Are there centers available in India? When I looked into their website, Pearson VUE Test Center, it appears there are some centers available in India. And I'm not sure they do administer this test. And I would assume why not. So you might want to do a little research in going into the Pearson VUE Test Center in India, make them a phone call and ask them, hey, I'm planning to take FPGEE test. Are you offering it? If not, why? So you might want to get that information. And also there's another option that once you have the letter, the ATT email letter, it's my own thinking. It might be faulty thinking. You might want to take that email letter to American Embassy and inquire, telling them, I want to take this test and I have been approved. Would you give me a visa? just a test, you might want to go and investigate that process. Like I said, it's my own thinking. It may or may not happen. You might want to check that out. Once you're approved, this is the first test you will be taking, either by coming over here or by checking with Pearson VUE Test Center. And I believe the foreign pharmacy graduate equivalency exam, this exam is offered most of the time only at the test centers within the US. So the likelihood of this being offered at a test center in India may be very, very negligible, but that's an option for you to check that out. But if the American embassy gives you a visa, and if you're able to come over here, if you have some friends or relatives, then you can come over and take the test right here. So that's the first exam that you will have to go through. And once you pass this, then there are some more exams. That would be the actual licensing exam in the United States called NAPLEX, North American Pharmacist Licensure Exam. And the next one is the MPJE, is the law exam, a fancy way of saying multi-state pharmacy jurisprudence, simply the law exam pertaining to that particular state. But the NAPLEX exam is common for all 50 states. You don't have to take NAPLEX in every state. If you take one time, then that's applicable to all states. And also you can transfer the score from one state to other states. And that's what I did. My first license is from New York City. Then I wanted to move to Maryland. I transferred the score, and all I had to do is to take the law exam, the jurisprudence exams for that state. Then I moved to Florida. Then I had to take the Florida exam, just the law exam. And then I wanted to come over to Vegas, Las Vegas. So I transferred the NAPLEX score, and then I took the law exam for Nevada, the state in which Las Vegas is situated. So the first step, after you pass the foreign pharmacy graduate equivalency exam, if you look at the bottom, start from number 1, you have the examination certificate, the foreign pharmacy equivalency exam certificate. And you need to confirm the licensure requirements on the board's website of that particular state you are interested in. If you want to, take the New York State licensing exam, then you have to contact them, and maybe you have to make a phone call and tell them I have the license, not license, the certification from the NAPLEX, the NABP, the Foreign Pharmacy Equivalency Exam Certification. I want to take the licensing test. And there are some requirements. They will go through your credentials again, consulting NABP, and most of the time, 99% of the time, you will get the approval to take the NAPLEX exam. So you go to the number 2, apply for NAPLEX eligibility. And the number 3, the final transcripts, the NABP already has it because you have already sent it. They verified it. Then they approved you to take the foreign pharmacy equivalency exam. So they should have that. So the state would, double check those credentials. And number 4, you receive the board approval of eligibility. The board is going to say, okay, you go ahead and take the exam. And number 5, is you have to purchase the exam. You have to pay a fee for that. If you're New York State, I happened to look at it yesterday. It was, I believe, $210 to take the exam. New York State has total of 3 exams, actually, the particular state. They had the NAPLEX and the MPJE law exam. These 2 exams is common to every single state. New York City has an additional exam called a compounding exam, wet lab. So there is an exam. You should be able to show your skill in preparing some of the extemporaneous preparations, like creams, ointments, powders, some capsules. Still, we do that. There is a specialty pharmacy compounding in the US as well. Then when you apply for the exam, licensing exam, you will receive another authorization to test from the testing center, Pearson View. And the last step, my picture is kind of hiding.
Sir, it looks fine here.
Looks okay.
Yeah,
okay.
Looks fine. Looks fine.
Okay. Okay, let me go back. Okay, I think I went to the next slide. Is that okay, Manoj?
You are on the community drugstore slide.
Oh, yeah, okay. So these are, here is the slide, and the last up is, you got the license and I have to, look for the jobs. And this is the job opportunities that are available in the US, not all inclusive. Mostly when the Pharm D graduates come out in the US, most of them go to the community drugstores, because community drugstores, all they need is a license. And if you have it, there is a pretty good chance of getting a job in a drugstore. If you want to go to the community and teaching hospitals like that one I'm in, they look for residencies. There is PGY1 and PGY2, which are residencies of 1-year duration, postgraduate year 1 and postgraduate year 2. Those are residencies. You focus more on the clinical pharmacy practice, and that would be preferred. If you don't have the residency, nowadays hospital look for the board certifications as well. So if you have a Pharm D, if you have a Pharm D with residency, and if you have a Pharm D with residency and a board certification, the one at the very last, the third category, has the chance of getting the job. Veteran administrations and military hospitals, you can work as a registered pharmacist. Veteran administration even advertise BCPS is preferred, board certification is preferred, and military hospitals. I happen to work in one of the Air Force hospital in Vegas right here in the year 2000 and 2004. I just wanted to expose myself how the military hospital works, which was a great experience. And there are some pharmacy benefit management. It's an organization that works with insurance companies, making sure they have a formulary established, getting rid of all the duplicates, expensive drugs when you have a less expensive same drug. So they work on those aspects to help insurance administer the prescription plan. There are jobs available in that category. Academics, teaching, of course, you're all familiar with that. I was a lecturer back in Manipal for 3-4 years, and also I was a teaching fellowship. I had a teaching fellowship in New York City when I did my master's. That was a great experience. If you have a Pharm D with residency, That's an opportunity to you to get it. Teaching, if you like teaching. I like teaching. Pharmacy administration, of course, if you want to be a director, do some administrative work in any area, drugstores or hospital director. That's another opportunity. Medication therapy management is an upcoming field. This MTM is a subject that might be a necessity in future to work with outpatient clinics, just to make sure when the prescriptions are prescribed, to make sure they are prescribed correctly, appropriately, before it gets filled in a drugstore. Medication therapy management, I'm kind of interested. I might go and do some certification at this old age because I'm crazy. Then pharmaceutical industries, like we talked about, manufacturing, cosmetics, formulations, research, those who have the penchant for research, that's an opportunity, and you can own your own drugstores, pharmacy drugstores. I tried to get into the sterile compounding business during the last 5 years. I was involved. Then I sold my partnership. I wanted to retire. I got out of that. So these are some of the places where you can get jobs. Jobs are not easy to get nowadays because of the rule of economy, the demand and supply. Because of too many pharmacy schools, I believe there are about 125 or 130 pharmacy schools in the US, putting out more pharmacy graduates than is needed. That's why the supply is more, the demand is less. When there is more supply and less demand, it impacts your salary also. That's your free enterprise, right? So that affects the salary too. If you work in a drugstore, my understanding is that the salary is somewhere between $50 to $60 per hour. That's a salary, not a bad salary, but that's how they start, around $50, I believe. These are the different opportunities. Pharmacy career possibilities. And what are the barriers and challenges? This is the most important thing, right? It's not an easy path. You heard me telling my journey. I never thought that I would be here. I never had a dream, even in my wildest dream, that I want to go to the States. No, because I wanted to stay in India with a family. So family is important. Family comes first. Children, your commitments, that's important. Number two is the finance, money. It's not, inexpensive process. Those who have the, financial background, they can venture into this process because exams itself, a couple of $100. The board certification, I believe it's $600. And the board certifications, I should have mentioned, that could be taken right there in India, I believe. If you have noticed, a lot of pharmacists from Middle East, I see a lot of BCPS from Saudi Arabia, Lebanon, those places, because there are centers right there in Riyadh. One other place in Egypt. And I understand there should be some centers, or we have to talk to the BCPS people, BPS.org people, whether they have centers in India. If your degree is okay with them, they might let you take BCPS right there in India. You don't have to come over here to do the exam. But for the foreign pharmacy, foreign graduate, pharmacy graduate equivalency exam, I believe you have to be here in the US. So that's an option. Of course, then if you want to travel, it's even more expensive. I think a round trip ticket is something like $2,000. Most of you might be able to manage, but not all of us. These are the exams you're going to go through, the stress of taking TOEFL, GRE, FPGE, NAPLEX, and the law exams. But, one can do it if they really, really want to do it. If they can manage the financial commitment, finance, and the travel, one might be able to do it. Then you have to get the visas and the green card. If someone has the opportunity to come on green card, that'll be nice. If not, you have to get the visa, travel visa or student visa, and then finding a job. And we have already discussed about the hospitals versus drugstores. These are some of the barriers and challenges that you might want to pay attention. Some of you might want to do, yeah, I definitely want to do it. This is my dream. I want to get it done. Give it a try. Try hard. And if it works out, beautiful. If it doesn't, then it would be a great experience. Charge it to your experience. And it's my thought. Put it all together. This is how I would think if I was one of you, the listeners. This is the process that I would go through. First, take the TOEFL exam, regardless whether you want to do the PG studies or not, come here or not. Taking TOEFL would be a good experience. Then apply for PG studies. In the meantime, those who definitely want to pursue masters here. This is the process I went through pretty much. You can do all these staying in India, taking the TOEFL and applying for the postgraduate studies. And then you can even process the application for the FPGE, staying in India. You don't have to come here. If one of these works out, then we have to worry about the visa. Go to the embassy, show the document. You want to take the exam. I got this admission. I want a visa. So that'll be the next step. Try to do PG, PhD. If you happen to come here on a visa as a student, either to do a PG or a PhD, then when you do that in the first year, you can work on the licensing process. That takes about 2 to 3 years. You do the master's or PhD, at the same time do the license. You have an option to fall back, this or that. And everything is successful, then you're here to venture the land of the free. That's what they call the America. So that would be my random thoughts. May not be a perfect thought, but some guidelines for you guys to think over. And if you have any questions, comments, please let me know. If I have misspoken, giving you some misinformation, please point that out. If I have done that, that would be the worst thing to do. Giving you incorrect information, misinformations, and raising your hopes up, and then it is dashed to the ground. Thank you so much, Manoj, and the audience. And I'm free to take some questions that you're going to streamline and send it to me. If someone wants to talk to me directly, if there is an opportunity, it's up to you, Manoj. And I'm here, and we will jump into the questions and answers. If I don't know the questions, I'm going to say I don't know, but I'll find out the answers and get back to you.
Perfect, sir. Thank you so much. Yeah, perfect. Thank you, sir. You may please stop sharing the screen.
Okay.
Yeah. And yeah, perfect. Thank you so much. Thank you so much for such a comprehensive and insightful presentation covering almost all the steps of higher education, various exams that one has to take for the opportunities in the US. Your presentation has been a ready reckoner for anyone who's interested to try his or her luck in the US. And I'm sure our participants today would agree with me on this. So now we shall take up some questions. So the audience, if you wish to ask any specific question to Dr. J, please raise your hand and I shall identify you, unmute you, and then you may ask the question live. If you want, you can switch on your video so the interaction is more presentful, or else if you don't want, no problem. So we have a raised hand, and Mr. Narahari, I'm giving you the unmuting right. You may unmute and then ask the question.
Can you hear me?
Yeah, perfect.
Yes.
Thank you.
Dr. J, this is not a small thing that you are doing. It's a wonderful job, and congrats, Manoj. There are very, very less pharmacy professionals who devote in bringing others' lives also up than looking after only their bread and butter. I'm really happy for that, and congrats for that good work.
Thank you so much. Thank you.
Dr. J, I'm really very happy for your great information that you have provided us. I work in a university as a faculty. Ours is an independent university. I just wanted to know if I have done my master's. I believe I'm 2005 pass out. Okay, so I'm quite old to take up the exams and come back there. And if at all any exams has to be taken, and if at all I have to come to US seeking jobs, what can be done? Is this the same process, or is there any other way that we need to take up?
Okay. Narahari, right?
Yeah,
Narahari. Hello, nice meeting you. You don't look that old. You look like a kid to me.
Thank you.
In any case, teaching faculty, where do you teach?
PS University, sir. PS University.
PS. Okay, you have a PhD and all that, right?
No, I don't have PhD. I have completed MPharm only, but I have 13 years of experience, 13.
Okay. Teaching jobs, I believe it's relatively, less stressful in getting it compared to the licensing and all that. For the teaching jobs, PhD is preferred in this country.
Okay.
But if you have a PhD, then you don't have to go through all those exams.
Okay.
You apply to all the universities, especially being here. There is a good chance of getting a teaching job. In fact, some of my friends with PhDs came over here and then they applied for the teaching jobs. One was PhD in pharmacology. And the universities, they are kind of liberal in giving them a job without looking for all the registrations, license, and everything. If you have that, that'll be an added plus point.
Okay.
Yeah, but you will probably need a PhD on that.
Okay.
In my little knowledge that I have on that. Yeah, you can also try applying to some other universities and see whether they would be interested, but most likely they look for PhDs.
Okay, thank you. Thank you so much.
Yeah. Thank you. Nice talking to you.
Thank you, Dr. J. Thank you, Narahari ji, for asking that. And if anyone else wants to ask any question, please do raise your hand and you may ask the question directly to Dr. J. Yeah. So Sadia, I'm giving you the unmuting right. You may unmute and ask the question.
Good evening, sir. Am I audible?
Yeah, perfect. Go on.
Thank you, Manoj, sir, and thank you so much, Dr. J, for this wonderful, informative, and insightful session. I have question that is there any failure limit or for NAPLEX, or that we can attempt unlimitedly for the NAPLEX exam?
Oh, great question. I hope if you get a chance, you will pass in one attempt. Your question is, are there limitations, right? Number of times that you can take the exam? Is that right?
Yes, sir. Yes, sir.
Oh,
yes, sir.
okay. I don't think you have a limitation on that. I took the NAPLEX back in, 30 years ago. I will have to recheck the rules. But if you go into NABP website, that will clearly state if there are some limitation. But as far as I know, that there are no limitations, but I will make sure I'll double check that. If Manoj would add that in the question list, that I may have to clarify in the future.
I'll do that, sir.
Yeah. Thank you, Sadia. Good luck.
Thank you, sir, for answering that. Anybody else wants to ask a question? Please do let me know by raising your hand, and we can connect back later on. Yeah. So I'll take up some questions which people have asked through that question, link which I had shared. So there is one question from Akhil. The question is, how is the scope of clinical SaaS after Pharm D in the US, and what would be the approximate salary?
Scope for Pharm D in the US.
Yeah.
Is that right, Manoj?
Yeah.
Okay. I'm assuming that Pharm D has a license here. If it is a Pharm D with a license in the US, like I said, discussed, there are opportunities in drugstores. You'll be able to get a job relatively easy. Getting into hospitals would be relatively little difficult because of the board certification requirements and the residencies, for the simple reason you're directly working with the patient on the floor with the doctors and nurses. That's the reason for that. A little bit of clinical pharmacy practice experience. In the drugstores, of course, I'm not minimizing the importance of the board certification. Drugstores, you are mostly filling the prescriptions, screening for drug interaction, dosage checks, etc., and involved with insurance, coverage and all that. So that is the situation on the scope. And the salary, like I said, in the drugstore, it starts anywhere from $50 in the beginning. In the hospitals, actually, they pay less than the drugstores. Depending upon the state you come in. Some of the states, for example, California, maybe $60. Some of the Midwestern states, low expense. Cost of living is minimal. It may be $45. But I would think anywhere from the minimum $40 to $60 to begin with. I don't mind sharing my salary. But when I began my job back in Coimbatore, it was 350 rupees. It's about $5 per month. When I came to New York City, my first job as a pharmacist in a drugstore, I was paid $15. That was back in 1987, $15. Then it went up, $30, $40. When I retired, I was making $85 per hour. Just to give you an idea. Still, I'm poor though. Does that answer your question for that person, Akhil?
Yeah, that was it. Thank you. So next question would be from Ravi Kumar. Yeah, you may ask the question. You may unmute yourself.
Hello.
Yeah, go on, Mr. Ravi Kumar.
Hi, sir. Good evening.
Good evening.
Sir, is there any opportunity for pharma industry persons in the USA, sir?
Hello, Ravi Kumar. Industrial pharmacy. There are some opportunities. I'm not quite familiar with the pharmaceutical industry side of it. But most of my friends who did the MS in industrial pharmacy in the New York City back in the 1980s, they are all in industries. If you do MS in industrial pharmacy specialty, there are some reasonable opportunities. Coming from India, M-Pharm in pharmaceutics is good. You might be able to find some job, but having that specialty, industrial pharmacy or cosmetics would be an added benefit, which is only 2 years. But I don't have a complete picture of the job opportunities in the pharmaceutical side. But I would think it's an option.
Yeah, thank you, Dr. Jay, and thank you, Mr. Ravi Kumar, for asking the question. Anybody else wants to ask any question? Yeah, 1 second. Kalavati ma'am, yeah, good evening. I'm just giving you the unmuting right. Please go on.
Good evening, sir.
Good evening, Kalavati.
Myself, Dr. Kalavati, sir. I've done my MPharm in pharmaceutics and a PhD from Andhra University. You did mention that some universities for faculty positions, there would be some vacancy. How to go about that, sir?
You have the PhD, right?
Yes, sir.
Okay, yeah, then I would say you're the real doctor. Just making a joke here. Yeah, what I would suggest, it is better, if you could make it over here on some visit visa or, some kind of a visa, student visa, or if you can make it, then from here, it is easy for you to apply and it is easy for them to, hire. There are universities are looking for PhD candidates like you. From there, from India, the only thing I can think of is to go through the AACP website. AACP. That's the website, Manoj, that was right beneath the MS specialties.
Right, sir.
At the bottom.
ACP, sir.
American Association of College of Pharmacy, I believe, AACP.org.
AACP.org, yeah.
You will see all the colleges that offers courses, master's degree in your PhD specialty. Pick those universities and give it a try. Send them the application to the dean or the departmental head, chairman, or the professor, and give it a try. That would be my suggestion. If they are in very badly need of pharmaceutics professor, then I think you might stand a chance. But they have to arrange for the visa, which is a big thing.
Okay, sir.
Obtaining visa is going to be difficult for the reason that they have to justify the immigration department that we are not able to get a candidate similar to this qualification, which usually they don't want to go through that. So if you're here, then they don't worry about your visa status. You can apply. It's not their business to check the immigration. But there is another process that you can approach a lawyer. And I believe that process might work. I'm not an immigration lawyer or something. I'm just giving you some information based on my own experience.
Okay, sir. Sir, is there any age limit or something like that? Because even I'm 47 years old and at this time with 13 years of teaching experience, but I don't know, do they have some limit like that?
No age limit.
Okay.
United States does not discriminate. No age. They're not supposed to. No age limitations at all. Yeah. If I want to be a professor now, in fact, I'm applying for some of the universities that are part-time teaching, clinical pharmacy. Some of them offer, they want me to do full-time. I'm over 65 now, so age is not a criteria.
Okay.
Yeah, good luck.
Thank you.
Perfect.
You're welcome.
Thank you, Dr. Jay. Thank you, Dr. Kalavati, for being with us. Thank you so much.
Thank you, Manoj.
Thank you so much. Yeah. So anybody else from our participants, okay, Narahari, I'm giving you the right to unmute. Please go on.
Thank you, Manoj. Dr. J, I just wanted to put one request from my side. Can you, I think with the permission of Mr. Manoj, if we offer you a webinar like this from our university, can you please take some time to share your valuable information?
You mean the same webinar, same thing?
Yeah, based on almost same. I think apart from this, any industrial aspects as well, if you can join with this, along with this, any industrial opportunities also that can be added to this and shared with the students, it would be great because we have B Pharm, M Pharm, PhD as well. So PhD scholars are also there in the university. So I think everyone would be interested to know the opportunities outside India.
I will be glad to, but this webinar, actually, I'm going through Manoj. If it is okay with Manoj,
That's fine, sir. No problem.
that's fine too. And Manoj, I've found Manoj to be a scholar and gentleman. I have met him in the last couple of months through LinkedIn. I read his writings and opinions and comments, and he displays quite a bit of compassion, and his willingness to help pharmacy professionals in general is great. And I'm fortunate that I have the association with him. I should be able to do that myself. If you want to go through Manoj, it's up to you. He seems to be a good organizer, and everything is going well. So I kind of like it.
Yeah, thank you.
Not a
Thank
problem,
you.
sir.
Yeah, Mr. Manoj, if you can just share the email ID, it would be great.
I'll reconnect with you after the session, and then I'll share with you all the
Sure.
information.
Sure. We will definitely send an official mail to Dr. J. Yeah, thank you so much.
Where are you located, Narahari?
Bangalore, sir. I'm
Bangalore.
located in Bangalore.
Bangalore. Okay. Manoj is also in Bangalore.
Oh, fine.
So
I stay very
I'll
close to
contact.
PS, so not a problem. I can connect
in the
you.
proximity. Yeah. Okay, great.
Thank
Thank
you.
you, sir.
We'll
Thank you.
connect you.
Thank you.
So thank you so much, Dr. J, and thank you, Narari ji, for asking that. And we'll have a continuous webinar series to help our pharmacy professionals for sure in India. So there are a couple of questions, but most of them are not related to this session, so I'll not take up. What is the scope of clinical pharmacy in the US? It's a question from Hemalata.
Scope of clinical pharmacy
in the US.
In the US?
Yeah.
That appears to be a question that we have discussed and along the presentation.
Yeah.
Clinical pharmacy, there's a very good scope. But the thing is, you got to go through those exams, licensing process, and everything else. Once you get the licensing certification, there is a very good scope, actually, although there is competition because of too many graduates are coming. I would, if I were you, the audience, clinical pharmacy is a great discipline, because it is going to be more and more patient focused. You're going to be with the doctors and physicians and nurses and other practitioners, healthcare professionals, working with them, and your input in the patient healthcare is crucial, because if the doctor diagnoses a disease, the drug prescribed, although it is a right drug, if it is not prescribed appropriately, without drug interactions, correct dosing, then the patient is not going to have the best outcome. So I would concentrate on clinical pharmacy if that's what your interest is. Thank you.
Thank you so much, sir. So there is one question from, Kartika. It's, she says, few words about the safety in the US.
Words about
safety. How safe is the country for?
Oh, excellent question. Kartika, safety is important. It's like any other country. America is safe, depending upon where you're going to be, depending upon the place you live. When I came to the US, I lived in Queens, and then I lived briefly in Brooklyn. Some of the areas in New York City, they are not, safe. So we don't have to go to those places like you go into Bombay, some places, right? There are some, risks in going into some other places. The risk is always there. But the law and order is here, and freedom is the theme the core of these countries. From it began 200 years ago, freedom. So you got a lot of freedom here. You can speak, you can practice freely. Your religious beliefs are welcome. You can do anything you want as long as we do within the law of land. So it all depending upon where you live, where you go. I live in Las Vegas. I'm in a safe place, community. If you go into Strip, some of the areas, they are not safe. It's all relative, but in general, it's a safe country.
Yeah, it's pretty much same as India, right? We have some places which are not safe at all.
Exactly. Yeah.
Yeah.
One other Manoj point I thought I should make it. There is such a thing called certification as opposed to accreditation.
Mhm.
When I talked to the ACPE, the Accreditation Council of Pharmacy Education, there are certain schools in Middle East and India, they have been certified. That's the ACPE from the US come over there, they certify certain universities. So that certification is not the same as accreditation.
Yeah.
There's a difference. So even some of those graduates from those certified schools of pharmacy, in India, I believe there is only one. And Middle East, there are a couple of them. They are all just certified. Does not mean it is fully accredited. That's why when you come here, you have to take the foreign pharmacy graduate equivalency exam. There's only one university in the whole world is given full accreditation by the ACPE, which is the American University of Lebanon, I believe. Okay. That was done back in 2003 or 4. Other than that, none of the universities have been given the full accreditation. So just to clarify that misinformation.
Thank you, sir. Thank you. So Nisha wants to ask a question. Nisha, you can unmute and ask the question. Thank you.
Hello. Good
Hello,
evening,
Nisha.
sir.
Good evening.
And I want to ask about the pharmacovigilance sector. I did my Pharm D recently, and I working at AIIMS Nagpur as a pharmacist. But I want to grow my career in pharmacovigilance sector. So my question is that what is the procedure to apply in pharmacovigilance in US, in hospital or in any company?
Hello, Nisha. Yeah, the terminology pharmacovigilance is not very much in vogue in this country. Pharmacovigilance, is nothing but patient safety, right?
Yes.
Patient safety is incorporated when you do a clinical pharmacy practice. It is part and parcel of the whole spectrum of clinical pharmacy. And to the best of my knowledge, I have not seen any particular university or hospital or any other institution having a specialty in pharmacovigilance. I don't think I have come across that. I could be wrong. But the terminology pharmacovigilance is very minimally used. I haven't seen them being used a lot in this country. So you might want to go through the list of the master's program that I listed. Is that one of them is patient safety? I'm not sure. Clinical pharmacy itself does cover that pharmacovigilance, adverse reactions and everything else you study. There is a process to report those adverse reactions and allergy reactions to the drugs, to the Food and Drug Administration, to the manufacturers. And there is a process here. So it's well documented, those idiosyncratic reactions from the drugs when patients take it. Does that answer the question? Okay, Nisha.
Okay. Thank you, sir. Thank you.
You're welcome.
Thank you so much, sir. Thank you, Nisha ji, for asking that. And I think it's the same issues with, countries like Canada. Also, we had a session with, a clinical pharmacist from Canada, and he also pointed out a similar aspect. Even in Canada, they don't have this pharmacovigilance concept as such, because the patient safety is incorporated in the first place in the entire, healthcare cycle from the very beginning. And they don't, have a specific pharmacovigilance related, job opportunities there as such. But yes, patient safety and community pharmacy and clinical pharmacy is something which is really, making a difference there in these countries. So thank you so much, Nisa ji, for that. And just in case any one of you have to ask anything, please go on. You can just write an email to me later on also, and then I'll compile all of that for Jay sir and then send it to him. And we'll see how we can answer those questions. So I've just sent my email in the chat box. If you have any specific queries, please do send it to me. Okay, so we have somebody. Okay, David, you can ask the question now. I have just given the unmuting right.
Hello, sir. So my name is David. I'm a Pharm D 6th-year student. So I wanted to know more about medical affairs in the pharmaceutical companies for foreign graduate in US.
Hi, David. Yeah, it appears your interest seems to be in medical affairs, meaning writing medical letters, things of those nature for the pharmaceutical drug products. I believe your opportunity lies more in the other areas here, because medical affairs, that kind of a job is done by anyone who can write medical literature. And the companies look for, cost efficiency, right? When they can hire some science graduate and take care of the medical affairs, they would opt for that. If they hire you, the salary is probably much more than what they would pay for, science graduate. That seems to be the practice that I have noticed. So I would suggest, if you're really interested, is that your cup of tea, then you might probably have to find areas within India. I believe there are some medical affairs in India, and they hire Pharm D graduates. Because right now, Pharm D is coming up in India, and you have to get any job you get because it is in the growing stage. And also we are going through the growing pain too, right?
Absolutely.
It looks like they're putting out a lot of graduates, and the job opportunity is not that great. It's like putting out a lot of electric cars and trucks, and not making the infrastructure done before that. So that seems to be the case. That used to be the case here too. Now it is widely recognized here in clinical pharmacy, and any graduate comes out of the pharmacy school has to be a clinical pharmacist. As the year of 2004, I think 3, it's all converted to Pharm D. There is no bachelor in pharmacy programs here anymore. Thank you so much for the question, David. Good luck.
Thank you, David. And David, just in case you are interested to, get into medical writing or medical affairs in India, you do connect with me. I have put my email ID in the chat box, and we'll see how we can, have a placement for you in India. And then we'll see if we can connect somebody in the US also and explore opportunities for medical writing. I'm not sure about medical affairs as such, because in foreign countries, they prefer to have MDs and MBBS doctors taking care of medical affairs. But yes, medical writing, they do prefer to have Pharm Ds and MPharm professionals. So we'll look into that. We'll have a specific chat on that, and we'll see how we can work with you, right? So we'll connect later. And thank you so much for asking that question. So
I think Manoj explained that better than I did.
Not like that, sir. I since I'm into medical writings, I keep talking to people in this space, and then we can have something in medical writing for sure. So thank you so much, participants. I would like to, say special thanks to Jay sir for, connecting early morning from the US and sharing his thoughts with us. And thank you so much, sir. I wish you have a wonderful weekend, and I wish all the participants a wonderful weekend ahead. And just in case you are part of my learning journey, we connect at 7 o'clock tomorrow at the India time. So thank you so much. And we'll meet again next week for exploring more career opportunities somewhere else in the world. And we'll meet again. So thank you so much, Jay sir. And thank you so much, everyone who participated till the end. And if you have any specific questions, please do write an email to me. And then we'll work together and see how we can, do something better for a better tomorrow. So thank you so much. Any final notes, sir?
Thank you, Manoj. I want to thank all of your friends in the participants coming through on a Saturday evening. I hope I have given some useful information. Like I said, if you have any questions, send it over to Manoj. He can condense it, we can streamline it and make it more efficient in terms of response from me. And I appreciate your all being here. And I want to thank Manoj particularly for arranging this. And I would like to let you guys know if you want me to talk about some clinical pharmacy practices, I would probably be more useful than the topic that I've given to you today. It's okay. So let Manoj know, or inform me through LinkedIn. We'll be able to give you some more webinars. Now I have the time, being semi-retired. All my intention is to give some good information and help the pharmacy professionals as best as we can. Thank you so much. Thank you, Manoj. Appreciate it.
Thank you so much, sir. Thank you all the participants, and we'd love to meet you again in the next webinar. And I'll request Jay sir to speak something on clinical pharmacy practice and community pharmacy practice sometime later this month, or maybe next month. We'll plan something, and we'll work on how we can, what time works for him and for all of us. So thank you so much, and we'll meet again in a new session. In case you want to share this video with somebody, please do share and enrich their knowledge and help them understand the career opportunities better. So we work for an open, free open access knowledge and help each other together. Thank you so much, and we'll meet again. Thank you all. And I have put the feedback link, just in case you want to request a new topic, you can do that via that feedback link, and I'll ensure that we'll have some session on that topic. So thank you, sir. And with your permission, may I close the session today?
Please do, Manoj. Thank you so
sir.
much.
And we'll meet again. Thank you so much. Yeah, good night. Thank you.